baby get the hepatitis B vaccine. So those are the targets of the WHO. We hope that these targets, could be met. We're also helping, by creating awareness about these things. Now, the elimination strategy, mainly involves creating awareness, like we're doing now, ensuring immunization of newborn babies, ensuring that people screen, and once one is negative, one should get immunized, and ensuring that people that have hepatitis C, are able to get treated and cured of the hepatitis C, so that hepatitis C too can be eliminated. So these are some of the things that WHO is trying to do. In Nigeria, we know that it's only when things are free, when things are affordable, that we can easily have this eradication strategy, accomplished. Like for HIV, it's been under control because there's been a lot of foreign donation, to right from the step of diagnosis, a lot of foreign countries, NGOs, they donate to HIV treatment in terms of maybe testing. And of course, HIV drugs have been free. But when it comes to hepatitis B and hepatitis C, there's no free testing, there's no free investigations, and there's even no free drugs for hepatitis B and C. So we call on people, in the government, policymakers, to look at this great burden, so we can also join WHO in achieving the elimination goals. Now, in summary, what is hepatitis? We say that it just means inflammation of the liver. We've mentioned the different causes of hepatitis. We've mentioned particularly the viral hepatitis, and also notably the ones that cause chronic long-term infection. And why do we need to screen? We need to know our status, so that if we are positive, we should get treated on time. If we are negative, we can get immunization for hepatitis B, and also to institute adequate preventive measures. And how is it transmitted? Numerous ways. We've said hepatitis A and E, mainly through contaminated food and contaminated water, while hepatitis B, C, and D, could be from blood products, sharing shafts, sexual contact, and very importantly, from mother to child. And how can it be prevented? We need to avoid risky behaviors. We need to get vaccinated, against hepatitis B as soon as possible. And is treatment available? Yes, we have treatment for hepatitis B that helps to suppress active infection to make it inactive, so that complications do not develop. And we have curative treatment for hepatitis C, so hepatitis C can be cured easily with this treatment. Thank you very much for your attention. I hope I was able to...
Go ahead. You wanted to say something, Doctor?
No, I was saying that I hope I was able to keep to time, the 10 minutes.
Yes, you were able to keep the time on the dots. Yeah, great. Well, thank you, Dr. Lukman Abdul Karim. Well, I didn't mention that when we started the program, but he's my brother, my younger brother. So I think I just need to mention that. Thank you, Dr. Lukman. Like we said, we'll be taking questions and answers. But like I also said when I introduced the program, we want our chairman to also tell us about Oasis Muslim Care Foundation, so that we know, okay, who are those who are actually, who organize this program. So our chairman in the few minutes will tell us what Oasis is, what are, of course, part of our goals, what you've seen here, to provide public health enlightenment to the general public. And like I mentioned when we started, this is our second webinar. We've been having a series of other programs which the chairman will mention, or which the chairman will briefly highlight. Once he's done doing that, then we'll take the questions, to be answered by the guest lecturer. So the chairman, you have the floor.
Thank you very much. First and foremost, I want to appreciate the doctor for that beautiful lecture, especially that has to do with a very important topic like this. So thank you very much, Dr. Lukman Abdul Karim. Oasis Muslim Care Foundation, as my brother Karim just said, is a foundation that was established to cater for the needy and the less privileged, especially in terms of their health. So the foundation has been in existence since 2009, and our cardinal programs are just focused on the health of the people. So we have a series of programs like Public Health Enlightenment Program that we do quarterly that involve provision of free healthcare services to the people, and we organize a public health talk for them. So also we have a program that is designed for schools. We target our school health enlightenment program as for students in secondary school, especially where we focus on issues that has to do with drug addiction, drug abuse, and drug misuse. Then the third part of our program is focused on the correctional centers, where we provide free health services for inmates of the correctional centers and also health enlightenment program for them. So the last program is the program that we are holding now, which is the second edition of our webinar. So we want to, cut across all areas that our physical program cannot provide opportunity. So that's why we call on the professionals to come and help us discuss, very important topics on health. Today, the program that our brother, Dr. Lukman, has helped us to explain ways of curbing viral hepatitis. It was a very enlightening program where he discussed these very important disease that is refers to as a silent killer. Talk about the causes, types of hepatitis, and transmission, the mode of transmission and progression. Also discuss about how we can protect ourselves as well as the symptoms of the disease. I want to use this opportunity to call our listeners, our viewers and the listeners to be expecting more from the Oasis Muslim Care Foundation. By God's grace, we will as well in the next 2 months invite another health professional to talk about different topics to enlighten us, because health, they say, is wealth. This organization is funded by the Muslim Student Society of Nigeria, the Ilorin Area Council, and we want to appreciate our brother, Dr. Lukman, for his presence, and also all the listeners and viewers at home for being part of this program. We are open to partnership. Any organization and individual that is ready to partner with us to assist us in this cause, we are open to partnership. Also, donations are also welcome. So our account number is on our website for those of us that are interested to be part of this the noble cause. So on this note, I want to thank our brother, and as well we will welcome questions that will be readily available to provide us with answer to those questions. Thank you very much for your attention, and we want to say Jazakumullah khairan to all our Muslim brothers and sisters online, and those that are non-Muslim that are also present here. We want to thank you for your time and for sparing your time to listen to us this evening. Thank you very much.
Yeah, thank you, Chairman. Chairman did not introduce himself. He's Dr. Abdurrauf Yusuf, PhD, not medical doctor. And like he did mention, this is our second webinar. The first one was on cancer and its causes. This is also related. Hepatitis also causes liver cancer. So, and we hope to provide other topics in the next. Our webinar holds every 2 months. So our next one is going to be in November. So we will be expecting our viewers to join us. So Dr. Lukman, the questions are already in the chat box. So I don't know if you want us to read them out, or you can just read them out and then answer them as they have been sent.
Okay, so I think I can just read them out and answer them, as they've been sent. So I can see the first question here is that which of the liver supplements would you recommend? Livolin Forte, Essential Forte, Liv 52, etc. Now, when it comes to viral hepatitis, if it is the acute viral hepatitis, which I said earlier that we just give supportive care, which includes multivitamins, then Livolin Forte, Essential Forte, or Liv 52 could be helpful. But when it comes to chronic viral hepatitis, we are a bit careful, in prescribing these drugs. They may be helpful, but we have to make it clear to our patients that they are not antiviral drugs. They are just mainly multivitamin supplements. They have no antiviral effect. I tell my patient that it's as if you have malaria fever and you are taking multivitamin. Multivitamin will not have any anti-malarial effect. So what you need to do if one has malaria is to get anti-malaria drugs. So somebody with chronic viral hepatitis, the important thing is to evaluate the person, for the need for antivirals or no need for antivirals. So such people should have antiviral therapy and not just Livolin Forte and Essential Forte. At times, we could just use it as adjunct therapy, maybe just supplement. That's what they are. They are just supplements. They are not really curative in any way. Why we discourage the use for chronic hepatitis at times is that some people will tell us that, oh, they've been on treatment for the past 1 year, for the past 2 years. How come they are developing complications? And by the time we ask for what drug they are using, they tell us is Livolin Forte. So any doctor that is prescribing this supplement should let it be clear to the patient that it is not antivirals. Anybody that is taking it to should know that it is not antiviral. One should need to continuously have adequate monitoring to know when antiviral drug, is needed. I hope I answered that conclusively. Then the second question is that can the elderly ones take the vaccine? Yes, elderly people can take the vaccine. Anybody can take the vaccine. The important thing is that one should get tested to be sure that one is negative to hepatitis B before taking the hepatitis B vaccine. The only thing is that in the elderly, the response to the vaccine may not be as adequate, compared to when younger people take the vaccine. So elderly people can as well take the vaccine. The third was good evening all, and the response is good evening. And the next one is how can we prevent vertical transmission? Now, in preventing vertical transmission, the first step is for the mother for all of us, we should know our status. And when we have a pregnant woman, first thing is that the parent should know the hepatitis B status. It's part of what is done during antenatal care. Part of the test that is done in antenatal care is hepatitis B, hepatitis C, and HIV. Now, when somebody has hepatitis B, if treatment is needed, even during pregnancy, we treat. There are drugs that are safe in pregnancy. And the aim of treatment at that time, aside taking care of the mother, is also to reduce the viral load, so that it reduces the risk of transmission to the newborn baby. So that's the first step, knowing the mother's status, treating if necessary. Whether treatment is needed or treatment is not needed, at delivery, there's what we call the hepatitis B immunoglobulin. It's an injection that should be given to the baby immediately after birth, or at least within 12 hours of birth, worst case scenario, within 24 hours of birth. And what this does is that it helps to mop up the virus in the baby in case there was any vertical transmission. So that helps to prevent the baby from getting, a vertical, transmission from the mother. And aside giving the hepatitis B immunoglobulin, there's also the routine immunization, which should contain the hepatitis B vaccine. So if the newborn baby got the hepatitis B immunoglobulin and the hepatitis B vaccine, it offers about 97 to 99% protection against, hepatitis B infection. So that's the way we should prevent vertical transmission. Then, is interferon the best treatment? I think this should be coming from a doctor. Interferon